Morning, friends. Mr. Lochan here at Medical Scientific. How are we all doing this morning? Um, I want to leave a message. I want to offer a little bit of guidance, a little bit of cautionary advisement to all patients, including persons who looking after patients, including relatives and friends of patients, including those of us who are very well read on the internet and other information platforms like search engines and all of these areas that you can get information from. And I caution all of you. All right, I feel very strongly about this. Okay, and there's a saying that says, and I say this in my classrooms as well when I'm teaching students. Since PVC come out, everybody is a plumber. You might find it's a bit strange, but since PVC come out, everybody is a plumber. Since the progress of the internet and search engines and information pathways and where everything and data is on the flick of a finger, literally, you find a lot of people diving into the area of knowledge, and they are unable to apply that knowledge. Data in its raw form can be dangerous. That data has to be assimilated, it has to be applied. So I have a concern today that I'm seeing, we are hearing a greater increase of people who are self-medicating, meaning persons who are probably ill with some medical condition: diabetes, hypertension, thyroid disorders, polycystic ovarian syndrome, cardiac issues, vascular issues, internal issues. And because they've got access to information, they bypass the important position of the clinician. They bypass the important position of the doctor. And as a medical technologist, I want to caution you. We are seeing a lot of people's lives being affected, their medical health deteriorating at the hands of their own doing, at the hands of their friends and their relatives. I want to caution you today, public, patients, relatives, friends, anyone who may be listening to this. We beg you, to stop self-medicating. Stop only taking the hypertension drugs when you get a headache. Stop adjusting your tablets for your diabetes based on how you feel you're going. Okay, I feel very dissatisfied this morning, and I just want to reach out to you. This is me. Okay, yes, I'm upset because I'm getting so many calls, so many communication with people, and when you speak with them, when you speak to them, they are self-medicating. They are bypassing and foregoing the involvement of a clinician, and they are taking antibiotics, which is called poor antibiotic stewardship. Let's not even talk about that. The global manufacturing of a multi-resistant organism, because people are easily getting antibiotics for things that they should not be using antibiotics for. As a medical technologist, again, I don't like calling out titles, but I'm telling you, we are killing our own selves. We are damaging our microbiome. We are damaging ourselves. And then when the horse leave the barn, we call and we say, it's the government, it's God. Why am I suffering like this? And I myself will have to suffer possibly for some of the bad decisions that I've made. How can someone who's a diabetic be self-medicating? How can someone who is hypertensive be self-medicating and have not gone to a doctor for the last 5 years, and their diabetes and their hypertension have gotten worse? They are now entering diabetic retinopathy, damage to the eyes, diabetic neuropathy, damage to the nerves, diabetic nephropathy, damage to the kidneys. And you have persons that are looking after these people and gathering information from www and those World Wide Web and Google and all of this thing. I'm not saying don't read. Your health is your investment. but I want to encourage you from the person who's sitting behind the bench doing the laboratory tests that a lot of people, including many that I know, are self-medicating, and you are foregoing the importance of your clinician. Seek consultation with your doctor so that he or she can guide you, can intercede, can stop kidney disease from progressing, can stop damage to your vessels, can prevent you from having worsening cancer issues and all of these challenges. I beg you this morning, medical, scientific, and community support services, we beseech you this morning, stop doing what you're doing. Public, patients, stop doing what you're doing. Partner with your regional health authority personnel, your clinicians, partner with your private doctors, and let them guide you. And to anyone who are diagnosing people in the public, to anyone who is diagnosing people and automatically putting them on medications and they are not medical doctors, please be guided that you can be embarking upon a dangerous journey with your patient. Please be guided that you are embarking upon a dangerous situation with your patient. All right? Put them in the hands of the right people, and the right people will put them in the hands of ultrasounds, of x-rays, of laboratory people, diagnostic tests, etc. All right, this is Mr. Lochan here at Medical Scientific, because I am hearing so many people are being led down a pathway that is not involving clinicians. And my goodness, don't even talk about bad habits with patients. They themselves can be their own undoing. This is me, very firm, very definitive, trying to guide you and help you, keeping it real. This is Mr. Lochan here at Medical Scientific. Partner with your doctors and let your doctors who are doing the right thing partner with the relevant diagnostic competency people, ultrasonography, radiology, all of these different scans and this and that and blood tests and all of that. Okay? God bless you. Take care of yourself. All right? And use the resources that are available to you in the people component, people who are qualified, certified, and doctors and all of these different professionals. I humble myself in their presence, but I'm also a servant as well, trying to help change lives one patient at a time. Check us out at Medical Scientific if you want to hear some more about some of the craziness that's happening here and how you could prevent yourself from being part of a crazy evolution of self-management by patients. God bless you.